I consider myself very fortunate in that I entered the field of infection prevention in the late 70s, and I moved to San Francisco in 1982 at a time where HIV was really just being identified. And what it really did was it changed the way we practice infection prevention. It got the attention of healthcare providers, many of whom were very frightened. The public was frightened. There was a lot of very inaccurate, misleading information in the news that got people really nervous about even caring for patients with HIV. But I think when I think about how it changed things is that historically, hepatitis B had been around for a long time, and everybody was just kind of cavalier about hepatitis B. People didn't want to take the vaccine even when it became available. And it was just one of those things that it was like, okay, it's just, part of being a healthcare provider. So when I think about what HIV did to how we practice, is it really revolutionized things. It forced us to think about the risks that healthcare providers put themselves in, every day that they provide care to patients. I think when the first occupationally transmitted case of HIV occurred, it really got people's attention. And I used to think of HIV, if every cloud, they say, has a silver lining, and I think the silver lining to the HIV conditions is that it really forced people to think differently, and it forced people to say, we should be practicing, better infection prevention than we are. So I think that it really did make a big difference. So I was very, very involved from the very beginning with the introduction of Sharps devices that were designed to protect the healthcare provider.
I actually received a needlestick injury in the early days of the HIV epidemic, before we knew what we were dealing with, really. I was involved in it was an emergent situation where we were drawing a blood gas on a patient. We knew that the patient was in trouble, and one of the residents had drawn the blood gas and was handing me the syringe, and drove the needle into the base of my thumb. So at that point in time, the CDC was doing a study, and I had a choice of either receiving prophylaxis or not receiving prophylaxis. So I think I'm patient 066 in the CDC study. I was blessed to have never converted, and at that time, AZT came in a bottle with a skull and crossbones on it, and so I decided that I didn't want to take that drug, and we didn't really know what we were dealing with, and I was wearing gloves, so I've been A-okay, but it's a much different world now than it was in the 80s. So this is an important thing you guys are doing.